My name is Matthew Eiban, and I am the clinical specialist for speech pathology in the regional hospitals for Vidant Health. So I work with infants who were born prematurely with feeding and swallowing disorders. I work with school-age children as early as 2 years old up to 12, 13 years old on speech, language disorders. And I also work with adults who have had a stroke or dementia with communication, language, speech, or swallowing as they get older as well. The best part about it is seeing the patients, seeing how they progress, where they started and how they get to where they end, and also getting to make that the same across the region so that we are treating patients where they are. They're not having to go to a big hospital, they're not having to go to a big city to get the same services there as they can in the region. At Vidant Health Hospital, we have a great team that meets together every day to take care of our patients. Everybody gets together to round on every single patient in the hospital so that everybody's on board with what the treatment is so that we can make sure the patient's getting everything they need in a timely manner and being able to get back home without having to stay in the hospital for too long. It's a very good team approach. The hospital does provide me with a good work-life balance. They've given us expectations of when we need to be here, and they've also told us when you go home, don't take your work home, you just need to spend time with your family and what you enjoy doing. We have a great support system here in the area. We love to get together to play games and to eat. Some of the games that we very much enjoy playing is volleyball. We like to get 4-on-4, 6-on-6, and go out to one of the sand courts in Greenville and play. I would tell somebody who's looking at a job at Vidant that you need to be flexible, you need to be compassionate, you need to have integrity, and you need to have accountability for your patients because we have a very diverse patient population. Just because we're rural doesn't mean that we don't have diagnoses that you see in the city. I think my choice to work at Vidant has been a very good choice. I've gotten to learn lots of different things within my field. The hospital has helped me get the training that I need to support the patient caseload that I see, and I only see myself going up from here. So I think that it's been a very good choice.